Dearly, thank you. All right, Liz, thank you so much for assisting us with our technology and appreciate this. So whatever you're doing on your end to press play, hopefully we'll hear it.
My name is Lynn Courier Stanley. I am the Executive Director for the National Association of Social Workers, Vermont chapter. And just as a background, Act 115 came about last year because a few years prior to that, I got a call from Alex Margulies, who is the partner of Leah Rosen Pritchard, who is the social worker who was killed by a client a couple of years ago. And he asked, is there anything that we can do? And I said, let's see what we can do. And so last year, so can we bring together a task force to look at the problems, look at the issues, and make some recommendations about what we might do for it. And so last fall, that's what we did. You'll have the list of all the contributors in the presentation. And this is the fruits of that labor. When people don't have their basic needs met, shelter, nutritious food, physical and mental health care, they're at increased risk for a variety of individual and societal challenges. According to 2023 data, 9.7% of Vermonters live below the poverty line. In our state, over 75,000 people are facing hunger. Over 16,000 of them are children. In August of 2024, 51 out of every 10,000 residents were homeless, placing Vermont second only to New York for the highest rate of homelessness in the country. Homelessness can amplify poor mental health. The stress of homelessness can increase mental health symptoms and substance use. Malnutrition can exacerbate not only physical problems, but also psychological challenges such as depression and anxiety. Children growing up in poverty have a higher risk of developing a mental illness. Poverty can increase the likelihood of mental illness through disparities in perinatal risks, malnutrition, trauma, social marginalization, and violence. The Cohen Veterans Network found that there's a large disparity in access to mental health care based on level of income and location. 42% of people found poor insurance coverage as the top barrier to accessing mental health care. Provider workforce shortages, transportation, and inadequate insurance coverage are all barriers to people accessing needed mental health care. While violence by a client against a social service provider is never excusable, given a lack of resources, increased stress levels, and increased mental health challenges, it may be more likely to occur. Meanwhile, social service providers connecting clients with resources, working to alleviate symptoms, provide mental health care and other services can find themselves in unsafe situations. The Occupational Safety and Health Administration, OSHA, found in one survey of 175 licensed social workers and 98 agency directors, 25% of social workers had experienced assault by a client. Nearly 50% had witnessed violence in the workplace, and more than 75% were fearful of violence occurring. In a study of child protective service workers, high levels of what was termed non-physical violence, such as yelling, shouting, and property damage, was experienced by 75% of child protective service workers. Physical violence was experienced by 2.3% of workers in the first 6 months on the job. Quality of service to clients is compromised when service workers are experiencing exposure to violence and burnout. Attention to safety in the workplace can reduce the level of burnout and help with staff retention. Of particular note is the correlation between transitions and risk of violence. The Vermont Department for Children and Families found that over half of the violent incidences occur within the first week after child removal, in the time between a child being removed from the home and the first visit with a parent or caregiver. Other transitions include the period of time immediately before and after a survivor of domestic violence leaves an abusive partner, where the risk of retaliatory violence against a survivor is significant, as well as a client returning to the community after being in residential substance abuse treatment, or when a client is transitioning from one agency's service providers to another. This might indicate a greater need for a safety net, increased communication between service providers, and more detailed planning. While we are concurrently addressing access to resources, increasing our workforce, and closing system gaps, we must also mitigate the risk of physical and mental harm to our social service providers. We contend that these issues must be addressed concurrently, as this is a circular problem. Lack of services and resources contribute to increased violence, and increased violence contributes to the lack of social service providers. The group identified training and systemic supports as key to keeping workers safe. New workers need training in their client population, agency policies and procedures, safety protocols, and de-escalation, so they do not exacerbate or create conflicts or contention. All workers need ongoing in-service training to address changes in the environment in which our direct workers are operating. Supervisors and leadership need training to support their direct care workers. While this is true, and this is one of those points that I really want to drive home, we do not want to encourage the myth that if a social service provider was, quote unquote, good at their job, they would be able to talk their way out of any challenging and potentially violent situation. Social service provider training, as found by OSHA, cannot be one size fits all. So much depends upon the client population and where services are provided, whether inpatient, in office, in the home of the client, or within the community. Safety protocols will and should look different. Systemic supports within an agency and between agencies might include scheduled check-ins, recognition, and support during client transition times when there is increased risk, and bolstering infrastructure to include self-service capacity, websites with resources, or panic buttons, all depending on the setting and client populations. There are a number of barriers to ensuring social service providers have the training and systemic supports that they need to increase safety. First and foremost is the cost of evidence-based safety training, the need to tailor the training to the setting, bolstering infrastructure, and providing quality supervision and oversight. Possible recommendations include expanding some of the private-public partnerships for training we are already seeing in some milieus. Institutions like hospitals are doing safe workplace violence prevention and safety training for their employees. The Department of Children and Families Family Service Division is already doing safety training for its workers who are in people's homes and within the community. Smaller agencies can partner with these larger organizations to have their staff sit in during these training times. We also highly recommend that volunteers and support staff are included in these safety trainings. Finally, we recommend grants for smaller organizations and agencies to conduct needs assessments and pay for training and improvements to infrastructure. Our workers provide invaluable services to our most vulnerable populations. They deserve to be safe and supported. Vermonters deserve to have their basic needs met, often with the support of these social service providers. And there's our list of contributors. And I need to also give credit to my student interns who did a lot of research.
They did a lot of work. That one little bill. It's great. Thank you. This is a good start.
So, Liz. Hi there. Thank you. Thank you for helping to facilitate. So on the next to last slide, was that the list of the folks who participated in the meetings?
Yes, the contributors were all the people who participated in the meetings.
Okay, it went by very quickly.
Mhm.
I'm just wondering if you can summarize for us, you know, what organizations participated in the meetings?
Yeah, totally. So we had some people, let's see, let me get a list of them actually. Yeah, so we had some executive directors from both the Champlain Valley Office of Economic Opportunity, an executive director on the Agency of Aging. We had executive directors from Vermont Center for Independent Living and a bunch of other social workers as well, who are also licensed clinical social workers and as well as MSWs.
I was just wondering, did you have any participants from within the Agency of Human Services?
I don't believe that yes, we did actually. We did have someone from the Agency of Human Services, and they're also a director of the Trauma Prevention and Resilience Development.
Okay, thank you.
Yep.
Um, uh, you know, this bill came about as sort of said in the introduction, because of workplace safety issues for that, people not only in state service, but outside of state service and their community partners experience in trying to do their jobs. And while in the medical field, honestly, there's been a lot more focus on that in the last few years here in the State House. There hadn't been as much focus on social worker safety for people trying to do their jobs in what can be difficult situations. So we appreciate having some of the recommendations that are contained here. I'm just trying to figure out how are these recommendations making their way to the state departments that, you know, would really be responsible for not only their workers' safety, but the grants that would go out to some of those smaller nonprofit organizations that do this in the community. In other words, have you done, I see the Agency of Human Services had overall responsibility for convening this, and I'm just wondering if within the agency, they've received the same kind of report and summary of your research and findings.
Yeah, so I can't speak on whether or not they have received this report. I do know that we are currently still in communication about who is going to, if grants are given, who is going to help distribute that money. And I think we have talked about the Agency of Human Services being that distributor to a lot of the people and the organizations that were involved in this meeting. I mean, there are so many organizations in Vermont that have social service providers, especially social workers. So we wouldn't be able to um, provide for all of them in terms of funding, but I think that's still in the works and still in progress.
Okay. If folks have any other questions or comments about you know, what we just saw or for Liz? Thank you. Thank you for the focus and the highlight on the issues affecting social workers. You know in the experience with DCF when there was, you know, one of their social work family services workers who was murdered a few years ago. More than a few now, actually. Yeah.
Come August will be 10.
It'll be 10 years, yeah. That the department had a mental health and support. They had a contract so that social workers could receive support, mental health support, and counseling. And it has sort of petered off from what I understand. I'm not sure how much of a resource they still have. So that would be something for us to be asking the department about because it's an ongoing issue, not only after you know, the horrible tragedy that happened, but you know, every day, you know, folks experience stressful jobs in going to their best to try to help individuals and families. So we will follow up on that with DCF to check on that. And then I noticed that there's a report that's due back to us that I don't know if I haven't checked our report page to see it's here, but around home health and the safety of folks in the home health area when they go out to do, obviously it's home health, it's in people's homes, to see what kind of issues that they have run across. There's some data that's been requested. Thank you. So thank you very much for being here today, Liz, and glad we could be somewhat efficient and not having you have to kind of repeat this several times, and appreciate the information. And we will follow up with DCF as well as with the report here that's supposed to be due to us from the Department of Disabilities, Aging and Independent Living. So appreciate very much, and thank you for being here.
Yeah, thank you.
All righty, take care.
Thank you.
Okay, folks, so just for the next few minutes, let's go back to that page where we were looking at reports that are due to us. We will be getting a report on the potential reorganization of the Agency of Human Services. We got a it's called Re-envisioning the Agency of Human Services. We did get a status update. I've read that report. It just says who they're talking to. It doesn't really say anything. But a full report is due later this year. So we'll see what that says. So I would encourage you to look at the most recent Raise the Age progress report, which is the March 2025 one. And as I said, we'll have DCF in here. We've extended an invitation. We don't know if they're going to accept it yet. Okay. Act 131, I'm suspecting that's about PFAS, but I'm not positive.
I just clicked on it.
Yes. Okay, we actually did take a look at that earlier when we had the PFAS bill that was here. So we've done that one. That's good. Act 76 monitoring and the state of Vermont's children in review. We did have our presentation on that already. So actually we've done better than I thought. Okay. Okay, Department for Children and Families.
We have a housing
In
in January.
We've had, there are multiple housing reports, and actually I look at them often, but they're on the department's website, but we also, I would encourage you, because if you haven't looked at them, there is actually quite a lot of information there. And it is important to kind of, not only look at current ones, but to look back and see, how they have changed. Yeah. The recording and storage of interviews, I think we talked with APS about, I'm not APS, but
Family
services about that.
Update,
Yeah.
I don't remember that one. What does that refer to?
It's very discreet.
Oh, actually, this is not what I was thinking about. Oh, okay.
Thinking about APS.
I'm thinking about APS
Yeah.
because they are recording
Both,
too. Yeah. So we heard from the APS folks about it, but we didn't hear from DCF about it, but we can ask so take a look at that one as well. We can, if they accept our invitation to present, that's all tied up in that, child welfare, reporting and interviews.
Abuse and neglect.
Yeah.
We got stuck on one part in the bill we were developing last year, and we told them, come back with how to resolve this one.
Okay. Special accommodations grants. I don't think we actually looked at that. What's it?
I don't even remember that. Oh, because it was 23.
Well, it was a report issued in September. So I'm gonna ask our childcare people to let us know about that.
I'm very familiar with
I think so. Okay. So our team that worked on childcare can fill us in on what's happening about that. SAG reports. All right. Restaurant meals, okay, thank you, yeah. I think, yeah, we're good.
Yeah.
Restaurant meals, we've actually talked about this. The language did not get included in the budget, but I know that they're still working on it. The advocates are still trying.
I can give you an update. I hadn't wanted to commit because I wasn't sure. A lot of folks had talked about, well, what about just using your SNAP dollars to buy hot food in the grocery store? That is not allowed at all under any program.
Right, that's right.
And so that is why these other programs have popped up is as a way of folks being able to get meals who can't prepare them themselves. It is a weird, yeah.
I think that's maybe not a universal, but an easier solution for.
An easier solution.
Yeah, but it is, and that's.
Right, I'd forgotten that when we were just.
And I was pretty sure, but didn't want to say, but I did confirm that. Yeah.
I knew that.
Get more. That's too bad.
Okay, so people are actually working on that in the building. So you can read that at your leisure. The operational costs, that was that's the
Yes.
recent one that we just got.
So we should bring feedback on it, because I did look at it, but the bill and all had left our committee, so Tiff was also involved from appropriations. This was about the whole issue of Woodside versus, where's the money flow? And so Tiff connected with, our hope was that the Senate with the appropriations bill would make use of that information to adjust our placeholder language. But so I didn't do a deep dive because I knew it was in their hands, but we ought to get updated on it. And actually, hopefully also updated in terms of what the Senate is doing.
Yes, and so part of what we've asked DCF to update us on is this report and
Oh, good. Okay.
the overall, what their plans are, so.
Okay, great.
So I would suggest folks, that, over the weekend or early next week, that you actually do take a look, read through that report. It's not long. But we had some concerns, that came about through the budget process that, what we have, in, that DCF has been sort of carrying forward ever since the closure of the Woodside Center, that that the plans that they have significantly exceed what they were spending previously. And so, what's the hole? Where is the money going? Where is it? How much of you still holding back? All of those kinds of things. And so take a look at that. All right. Our annual report from Dale. We talked about that. It's not, it's a data report. It's the one that I gave hard copies to Dan and to Todd, and there is another copy up there in the bookcase. I'm not sure that it's more of a reference document, so you can look at and see how many people are receiving X, Y, and Z services, and what the definition of those services are, who's providing them, et cetera. So that's not really something to get a presentation on. Also at Dale, we have the choices for care and allocating savings. We looked at that during the budget process, so we don't need to look at that one again. Essentially, they said they had no savings. And Adult Protective Services annual report. I don't think we actually looked at that when we were talking with Joe and John earlier. Todd, why don't you take that one on?
Okay.
Okay, take a look at that report and just kind of give us a summary of that, maybe sometime in the next couple of weeks. Adult Protective Services annual report. Okay, the rate study report. We already know about that one.
Yeah.
We've used that one extensively.
Yeah.
The GAA Emergency Housing Task Force, we've had that report from the
Yeah.
task force and utilized some of their recommendations in H91. The Alzheimer's disease and related disorders annual report.
That one.
Okay, that would be good. You sit on the commission, don't you? Yes. Thank you. The Health Equity Advisory Commission, that's something we don't spend a lot of time on here,
That's,
but
yeah, and that's actually primarily the healthcare committee's
Yeah.
jurisdiction. They created that commission.
yeah. And would you just take a look at it and see if there's anything in here that we need to, call our attention to,
I
I
will.
guess?
I did a real quick skim and there was some specific legislative action requests. So I hope maybe healthcare
Okay,
looked at it or will, but I can summarize that.
okay, just to see if there's anything that we needed to do.
Yep.
We've been dealing with the Human Services Board annual report, taking care of that. We did the opioid settlement advisory committee report. Substance misuse oversight and advisory council. We have not taken a look at that one. All right,
That's Eric.
it's Eric and Zahn.
Okay.
So, Zahn, I'm gonna ask you to take a look at that one, okay?
Sure.
Give us any kind of summary of things that maybe we need to pay attention to.
500 pages.
Read the executive summary.
No problem.
Need that in an hour?
Oh, okay. He was kidding. Okay, so the next one, has to do with, do you want to take that one on?
I'm
Ian?
volunteering.
You're volunteering. And might have a bias about this, I'm not sure. So one of the things that they need to do was that this, was outlining, improvements to evaluating, improving new qualifying conditions. That was something that we dealt with in this committee.
It's just the headliner, it's ridiculous to have it come to the legislature to add to legislation each time there's a proposed new condition that ought to be qualified.
Mhm.
And other states will have.
This is for the medical cannabis registry, or is that, or did we move past that?
Medical cannabis registry.
Yeah, it was one
Yeah.
part of a, report that they were asked to do, so.
We've been doing it similar to like PFAS, where it's
Yeah.
like each time we want to do a new thing, it's like, then you've got to there's got to be the bill, it's got to go through and all of the testimony.
Testimony, we're not really the ones who know this medical aspect, whatever.
Okay, so the next one is about deaf and hard of hearing individuals and the council. Dan, I'm gonna ask you to follow up on that one, okay? See if there's any recommendations in here that we should be looking at and seeing how they appear to be pretty active. ALS registry, we actually took a little bit of I don't know, I took a little bit of that review of that when we've been doing the
Yeah.
discussion of the rare disease advisory. It's actually pretty interesting. I'm actually glad that we did it. And I think it's very quick. It's not very long. I would encourage people to take a look at it because it's one of those things that the health department wasn't crazy about doing, but even Deputy Commissioner Dougherty said, seems like a lot of people who were identified last year for such a rare disease in a state with a population of Vermont, which I think was the original, one of the original reasons that the folks with ALS and their caregivers and advocates I really felt like we needed to have data in Vermont. So that's just it's the first report. It's just the start of doing that. The Community Violence Prevention Program. To be honest with you, I don't know a lot about that. Does anybody have an?
I don't know. What is that? Wow, it goes
Also,
through-
if I've assigned you something, would you also determine whether this is a one-time report or whether this is a report that's required on an annual basis or some other repeating basis, and make a recommendation about whether you think that we need to receive it on an ongoing basis, or whether it's a report that can be eliminated or moved to a less frequent basis. Okay, So, Esme, I'm going to ask you to take a look at this one, okay?
Sure, I'm interested in the next one as well.
Okay. All right.
The maternal, yeah, that one I looked into. There's some things I think in the maternal, is that the one you're?
Yeah.
That veer into our committee.
So, I'm going to actually ask you to take a look at all three of those next three, okay? Health equity data.
Yeah.
And just taking a look at, are there ways for us to better utilize the data that we're seeing? The Recovery Residence Certification Program, I'm going to assign to Eric when he comes back.
Do you want me to look at it in case he doesn't?
Sure, can I leave you with that, touch base with Eric about that?
Sure.
Yeah. Okay. And so the next two are,
Likewise.
yeah,
Yeah.
the same one.
Both of those.
Yeah.
Okay.
All right, lead in cosmetics. Act 131.
I'm
Is
interested.
Bren going?
Oh.
Interested?
Anyone, I mean, if-
I'm gonna ask Brenda to take a look at this. See what recommendations that they've come back with. And I don't recall, I think that this was a one-time report, but you can double check that. Vermont Ethics, we get this on an annual basis. And
I'm actually very interested in that.
are you?
Oh,
Okay,
good.
great. Okay, Zon, go for it. And then the Office of Long-Term Care Ombudsman, Ray, I'm going to ask you to take a look at that one.
And then there's the one that isn't on the list. And we
Yeah, you know,
talked
just
about
looking
whether
to
to
make sure.
add them.
You can look at it.
So,
Look at it.
we will,
I will
Add.
happily.
well, we're going to actually follow up with Dale
Oh.
because they,
Oh, DCF.
well.
Oh, we got different
We
ones.
have, yes, I have a different one, the one in Act 115 that we just
Oh, yes,
identified has not been
yes.
provided yet.
Yes.
So, I'm going to send, and what is your one?
Is the one that we didn't get for 10 years because we canceled it as not being needed, child transport.
Amazing.
And then after requesting the data, it took forever to get and it doesn't have data.
Okay, that's something that we can talk
ask-
during the.
Yes.
Yes,
Yes.
so we've got a whole list of things to talk to Deputy Commissioner Radke about. So hopefully you're listening, Erica. Okay. And I will follow up with Dale about Act 115, 2024, Section 4 report, which is about discharge of patients from home health due to
Oh, right.
their it brings me back to the comments you were making on the floor today, Anne, in favor of that part of the bill.
Right. I remember that one came up and having questions about it.
I talked
You've been bad. We're not going to serve you.
about what I'm doing,
Yes.
just trying to get the word out.
Yeah.
Just so you all are aware, House Appropriations has been very busy collecting information from all of our kind of state agencies about all of the federal funding that comes into our state government. Fortunately, we have lots of other federal funds that come into Vermont that serve Vermonters that don't pass through our state government. So I am compiling and collecting that information. So share that out with your communities. If there are organizations, coalitions, alliances that you work with or speak to regularly that you know receive federal funding that doesn't first come through our state, direct them to me. I've built out a spreadsheet that melds nicely with the one for House Appropriations. So we'll really be able to get a full picture of how different federal budget cuts could impact our state and our ability to provide services and support to Vermonters. Yeah.
Yeah, thank you. So we have several, many community-based organizations with which
Mhm.
state government works
Yeah.
that receive money directly from the federal government or have had grants directly cut or eliminated. I can think of Champlain Valley Office of Economic Opportunity has had over $2 million in grants cut. Local historical societies are having grants cut because they were going to get the money from the State Historical Society, and that's been cut. Yeah, Brenda.
And I just found out the school system gets federal grants for homeless children to buy them clothes and stuff.
Yes.
Well, more
all
than
new
just
to me.
that, yeah.
No, no,
Yeah.
more than just that.
Yeah.
I didn't know that.
Yeah.
It was in the paper.
Yeah, there's millions of dollars that go to schools from federal government that are.
And
at
they're
risk
worried
right
about
now.
that.
Yeah.
Because we have 37 homeless children in our school.
Oh,
Yeah.
yeah, I mean,
That's a small school. That's
homeless,
1,200
the
students.
number of homeless youth in our schools has doubled, and our unaccompanied homeless youth in schools has doubled in just 2 years.
I had no clue.
Okay, I also
One
just.
more thing, do you want me to have Jen contact you? The person
That,
that,
that'll be covered in
That'll
what
be
House
covered.
appropriations
I didn't
is.
know if you wanted me to call her and have her contact you.
Um,
She's the head of it.
Yeah.
if you want her to, if there's any, sometimes, you know.
I'll just
they
give her
do-
your email and
Yeah,
say,
Yeah, if there's any,
contact her
sometimes
later.
they apply for, some schools will apply for grants separately, so.
She runs
Yeah,
that.
so, yeah.
Okay.
Yeah, people know about that at Agency of Education
Okay,
and
yeah.
appropriations is taking care of that.
Okay.
But I appreciate you taking on that task. So just as an FYI, an example, Mike Fisher, who we see in the building all the time, he's a long-term care and health, not long-term care, scratch that, healthcare ombudsman.
Yeah.
And 2/3 of their funding comes directly from federal government. And so, and that's, they've been notified essentially that that's probably going to be cut. The healthcare ombudsman, they touch a lot of lives out there when people have questions about healthcare or
Signing
they-
up, yes.
how to sign up to or how to appeal a decision or any of that kind of stuff. They've been a real asset to the state. And so anyway, so it's all of those kinds of things out there that we're trying to, when I heard that appropriations was doing this for when I heard appropriations was doing this for state organizations, they're like, well, we got so many partners who get money directly that we need to understand the full impact. So, okay. And then also just a public interest, a personal interest. I'm on the Joint Legislative Management Committee, and we have responsibility for reviewing the plans to make the State House more accessible. So if people are interested in the latest update, I'll just leave the presentation here on my desk. You can take a look at it if you want. It's kind of interesting because it shows sort of a historical perspective about when the different elements of the State House were changed. So that's right here. What we're looking at for next week is we'll be voting out H46. We've got contact person at UVM to try to get somebody in to testify about whether the university is willing to take on the Rare Disease Advisory Council. Requested a fiscal note on the, it's actually pretty minimal because most of the people will be paid under their jobs. So, and it's only going to meet quarterly. So, so that will come from Nolan. On H248, we're going to continue we have a couple more witnesses. That's the childcare changes. We have a couple more witnesses coming in next week. But then we will be looking at what's the best avenue for that bill. So it has a couple of different ways that it could go. Doug, why don't you give the committee an update about your work yesterday in House Corrections and Institutions?
So continuing S36 winding its way through the building with a few interested parties. We were in corrections yesterday afternoon. A number of questions. There was questions about process with respect to how people reach corrections. Can they arrive on their own or brought by someone? Do they get a medical exam? And it sounds like there was some confusion, but clarification by the end, I think, on where the medical exams take place and how they take place, and referrals to hospitals. I think the committee on balance was understanding of the current status and the challenges of the PIPs, the PIPs, a desire, a lot of head nodding and words of support from Representative Hedrick to try to get Chittenden County back online, and appreciation by him and others that we are prioritizing Chittenden County just by the numbers that it would it has for people who need assistance through a PIP. So there was no obstacles raised that would impede the progress of S36 that came from that conversation. We're looking to schedule next week Representative Rachelson, who has some questions and concerns. She's considering an amendment. She'll come in and discuss that with us on Tuesday. We'll make some time. As I understand it, her focus or interest is still trying to ensure, I think she's challenged to accept that this is our best, in some cases, our best option, as I think we were all wish that it was not needed to have folks go to corrections. She seems to have an interest in whether we can help refine and define when it is available as an option. So she's going to come in and discuss that. And we have not heard yet from appropriations with respect to when they'd like us to stop in.
And Judiciary will be contacting us as well.
Okay.
Barbara
coming here is not in lieu of that.
It is not in lieu of that, but she's coming on her own. The only purpose in going to Judiciary at this point in time, according to the chair, is they have a similar provision in their miscellaneous bill that came over from the Senate, I think. So he just felt just to show that the issue is being addressed, but in a different committee. And he feels that that we are the appropriate place to address it because it's more programmatic than legal, because no charges are being filed against a person or anything. So he just felt like a brief overview. So we may, no, that's fine. We may get an invitation for him to go down sometime on Tuesday. Yeah. So, and all depends on.
Talk about the amendment.
Yeah, go ahead.
So we had talked some off and on about the term, the public inebriate, and just it's a term that kind of has negative connotations and isn't really used anymore. It's actually not in statute, so we're like repealing.
We were about to put it in.
So that would have been
individual.
Yeah,
no, it's not just
we
alcohol.
use language, and that's the other problem is it really is a term that's used for folks who are under the influence of alcohol, and we know actually a lot of the people who are making use of the pit beds right now are stimulants, and there's just a lot of a variety of substances out there. So I had an amendment drafted, which is actually going to get changed a little bit, and I'll talk about that part next, using language that kind of already exists in our in statute. And so we're going to strike out public inebriates and replace it with persons who are incapacitated. That's because that's kind of language that already exists and is defined in our statutes.
And very much ingrained from the DOC perspective. Alice, Representative Emmons' history on this is lengthy, and INCAP is as they refer to it, INCAP for incapacitated.
INCAP.
Yes. So the amendment just kind of goes through and updates that language where needed, and then there's also the report about the work they're going to do. My understanding is buildings and institutions wanted to just be added on. So that will be the other part of the amendment. Katie is working on that, and I will send it out to the committee. And so we're just going to see if everyone agrees with the amendment. We can do it as a committee amendment. If not, then folks who want to sign on can sign on to the amendment.
Another past term was under the influence. So,
Yeah,
I guess you would.
when Katie went back and looked at the underlying statute,
Yeah.
incapacitated was the word that was already used.
okay.
And so,
The newest version is like if you talk to policemen and stuff, it's people under. the
yeah.
influence.
So, so just trying to keep it consistent and,
But I don't like that incapacitated either. But anyways,
anyway, so it was, because we had voted on the bill overall as 11-0 vote. We wanted to bring back the amendment. If it's something that people want to sign on to, you're welcome to sign on to. If not, that's fine too.
So yeah, so I'll send it out to everyone as soon as I have it, and we'll see how we want to go from there.
I think, Brenda, to your point or your question, under the influence doesn't quite necessarily reach the level of where someone would be involved in
Yeah.
HIP or DOC. I could have 3 beers and certainly be under the
Oh,
influence,
that's
but
true.
unlikely
that's
to reach
true.
the level of being incapacitated.
that's just, see, I've never been
just-
drunk, so
Yeah.
I can't really compare. I've never tried.
I can tell you 3 beers would make me incapacitated.
It wouldn't.
Anything
One would make one because I don't drink at all.
All right, folks. So that's what's up for next week. We are, we're still, that's still in April. In middle of May, we're going to do a field trip, off to the, ribbon cutting of a, hotel turned shelter in, Chittenden County. Yeah.
Oh, where?
I have the information. I can't remember exactly where.
Oh.
Excuse me. Excuse me. And then, I think I mentioned this, but we are, gonna take a look at H-120, which is the study and design of a long-term care trust fund. We're trying to get the state treasurer in, on that. And, I think, Lori, we should invite Representative Yakavoni too. This has been something that has been something that he has talked about for a very long time. And, if you could invite him as a witness, I think that would be great. Don't you, Dan?
Sure.
Um,
Which number is that?
it is H-120. It's over, it's in the middle
We get a trust fund for
for long-term care. If you go to a nursing home, if you require care in your home by people to come in, people are probably familiar with long-term care insurance that insurance companies try to sell that doesn't really cover anything. I know Zon has had personal experience with this. So the
I
concept,
took care of my parents and when they wanted anything, but that was me, of course.
well,
I've had friends that did get paid.
so.
I wouldn't do it.
So for instance, I don't have any children. I might outlive all my sisters. I might
Okay.
get somebody to help me.
That's a good example.
Yeah. Anyways, it's a concept and, it's been on the wall, ever since I've been here. So I don't know. So I figured out, well, at least
Well,
learn about what the possibilities are. Yeah, Dan.
And actually, I'm trying to find the bill, but we passed it in the House and it failed in the Senate in the 70s.
So people would put away their own money, not state funds, into a trust fund for their long-term care.
It would be set up.
State.
Well, it could be,
We don't know what it
something
is.
else.
to learn more about
We need to learn more about what it
They wanted to set up a trust.
Right, like, Vermont Saves, okay, that's something that treasurer has set up. It's deducted from people's, personal
Right,
money, but it's
yeah.
their money in there. So,
Their own money.
okay, and then we'll figure out from there, we're still slated, just so you know, for your personal schedules, we're still slated to be holding till the end of May. They're hoping to be out earlier than the end of May, but, I wouldn't say a lot earlier. Let's just put it that way.
Are they gonna do an adjournment pool?
Oh, yes, I know. So,
What's that?
so an adjournment pool.
What's an adjournment?